Hello, my name is Megan Choi. I am the head of the infection control and prevention within our organization. This is an important mandatory training for all our staff to attend due to the rise in Middle East respiratory syndrome, also known as MERS, cases in our local community. What is MERS? MERS is a viral respiratory illness that is caused by a zoonotic virus, more specifically a coronavirus, also known as MERS-CoV. Public health professionals and researchers found that the first reported case was in Saudi Arabia in 2012. Although this virus has not caused a global pandemic, statistics show that there are several cases in other parts of the world outside the Arabian Peninsula. In 2015, 180 cases were reported in South Korea, and in 2018, 2 cases in the United States. The World Health Organization has also found that about 20 countries worldwide have reported cases of MERS, a total of 2,608 confirmed cases globally, and about 35% of cases reported have died. So why is this infectious agent important? This is because MERS is infecting people still to this day, although not at a very high risk. But it is a virus that we don't want to get infected by. Just like COVID-19 and SARS, both are connected to the coronavirus, and it puts fear into people, especially since we recently experienced a global pandemic in 2020, which was COVID-19. Who is most susceptible to MERS? Well, unfortunately, it can affect anyone. This virus spreads quickly and indiscriminately for one's race, ethnicity, gender, and age. However, the most susceptible people would be those who are residents of the Arabian Peninsula, recently traveled to the Arabian Peninsula, were exposed to infected camels, and were in close contact with any ill traveler. As we run a healthcare facility and some patients have been admitted due to MERS, I want to make sure that all our staff and patients are safe. For staff and patients who are in close contact with these infected patients, not practicing infection control protocols, and are struggling with diabetes, kidney failure, chronic lung disease, and weak immune system. So let's talk about the virus and how it's transmitted from animals to humans. First, researchers have found that it started from bats that carry the coronavirus. Then through cross-species transmissions, camels, mainly young and adult dromedaries with a single hump, are infected and carry MERS-CoV. Then through zoonotic transmission, humans who are in contact with these camels get infected. This virus can spread through close and unprotected contact. However, it doesn't stop there. Infected persons can then spread the virus to people within their community, homes, and healthcare facilities through respiratory secretion, such as coughing. But there is no precise way for this virus to spread. As of right now, researchers have linked all cases to those that traveled or reside in countries in and near the Arabian Peninsula. We hope that no one gets infected, but in the case of which it happens, here are the following signs and symptoms to look out for. MERS causes flu-like symptoms and can range from mild to severe. For those who have mild case, patients will experience common symptoms such as shortness of breath, fever, cough with or without blood, sore throat, muscle and stomach pain and soreness, vomiting, and diarrhea. For those who are experiencing more severe case, we can see patients develop pneumonia, breathing failure, kidney damage, high fevers, and even death. Studies have shown that symptoms can start to appear from 5 to 6 days and develop from 2 to 14 days of exposure. Let's talk about diagnosis and testing for MERS. If a patient is experiencing symptoms of respiratory illness and recently traveled to the Middle East region, then that alone is enough reason to suspect that a patient may have contracted MERS-CoV. Healthcare facilities such as ours would have to do chest x-rays, run blood tests and kidney function tests, and even take respiratory samples for evaluation. There are 2 types of testing that can be conducted by the state or CDC labs to detect MERS. We have the polymerase chain reaction, also known as PCR, and we have the serology testing. For PCR, we would test either with respiratory, serum, or stool samples, which can quickly detect MERS-CoV within patients. For serology testing, we would measure the presence and concentration of antibodies within patients and hopefully see if they have been previously infected before. When it comes to treatment, there are no current approved treatments and vaccines ready to administer. Most mild cases can recover without complications, and with proper care at home and social distancing, most patients would feel better in no time. For more severe cases, patients will need to be admitted to a hospital, and doctors may recommend the following: a breathing tube, mechanical ventilator or respiratory, antibiotics, and intravenous fluids. For a preventative measure, I strongly recommend our staff and our community members to avoid traveling places in the Arabian Peninsula, avoid coming in contact with camels, and especially do not drink raw camel milk or urine, or eat any undercooked meat, particularly camel meat. Some other preventive measures that you can practice to stop the spread of the virus is by washing your hands, often with soap and water for at least 20 seconds. Use alcohol-based hand sanitizers. Cover your nose and mouth with a tissue when you cough or sneeze. Avoid touching eyes, nose, and mouth with unwashed hands. Avoid personal contact with sick people, and clean and disinfect frequently touched surfaces and objects. As the head of infection control and prevention, it is my goal to ensure that all staff within this organization are safe and healthy. We recommend all staff follow the following infection control protocol, which is following standard contact and airborne precautions, have appropriate PPE at all times, follow respiratory protection standards, follow safe waste management protocols, and practice safe and clean hygienic practices. Lastly, it is important to keep all our rooms sterilized and clean. What this means is that we want to ensure there are enough engineering controls, such as ventilation, and administrative controls to reduce exposures. Clean and disinfect all surfaces and equipment, and make sure to use any EPA-registered hospital detergent and disinfectant. Remember to clean all patient rooms daily and to keep all cleaning supplies outside of the patient room. For more information, I highly recommend checking out the CDC or the World Health Organization website for more information. And lastly, thank you for those who have attended this training. Please make sure to stay safe and practice infection control and prevention protocols. Thank you very much.